Good day, everyone. I am Chisum Great. Today, we'll be looking at the muscles of the back of forearm. This is the back of forearm. So, we'll be looking at the muscles at the back of forearm. So, there are about 12 muscles at the back of forearm, and the muscles in the back of forearm are categorized into the superficial group and the deep group. The muscles in the superficial group are about 7 in number, while the one in the deep group is about 5 in number, making it a total of 12 muscles at the back of forearm. So we'll be looking at these muscles one after the other. Then before we go over to seeing these muscles, the muscles of the back of forearm have a common origin, which is the lateral epicondyle here. So you can see this muscle, all of them arises from this point. Most of them rather arises from this point, which is the lateral epicondyle. So I'll show us this muscle before we go over to the origin and insertion of this muscle. First of all, let's see the superficial muscles in the back of forearm. So we have this muscle from lateral to the medial. From lateral to the medial. This is the lateral side, and this is the medial side. So this is the brachioradialis muscle here. Then this is the extensor carpi radialis longus. You can see it has a long tendon from the name longus. This is the extensor carpi radialis brevis here. Then this muscle here is known as the extensor digitorum. This is the extensor digitorum. Then we have the extensor digiti minimi. This is the extensor digiti minimi. We have the extensor carpi ulnaris. This is the extensor carpi ulnaris. Then we have the anconeus here. So you can see the anconeus here. So we are going to be looking at the origin and insertion of these muscles, one after the other. Starting from the brachioradialis, it originates from the upper two-third of the lateral supracondylar ridge of the humerus, and it runs posterolaterally. So you can see it runs on the posterior and the lateral side to insert at the distal end of the radius. It inserts at the distal end of the radius here, just before the styroid process. That is where it inserts. Then the second muscle we have here in the superficial group of muscle is the extensor carpi radialis longus here, which originates from the lower one-third of the lateral supracondylar ridge of the humerus. So you can see it is under this muscle, which shows that it is on the lower one-third of the lateral supracondylar ridge of the humerus. That's where it originates. And it runs downward laterally, or it runs downward posterolaterally rather. It inserts at the base of the second metacarpal bone here. So this is where it inserts if you trace the tendon. Then the third muscle we have is the extensor carpi radialis brevis here. So this extensor carpi radialis brevis originates from the lateral epicondyle. You can see where it originates from the lateral epicondyle here, and it runs downward on the lateral side of the posterior aspect. It runs downward and inserts at the base of the third metacarpal bone here. So this is the point of insertion at the base of the third metacarpal bone. Then the fourth muscle we have is this muscle, which is the extensor digitorum. It originates from the lateral epicondyle here, and it runs downward. As it approaches distally, it splits into 4 tendons. As you can see, It splits into four tendons: the first tendon, the second tendon, the third tendon, and the fourth tendon. And these four tendons insert at the medial four digits. So from the lateral side, this 1, 2, 3, 4 are the medial four digits. So each tendon goes to one digit, another tendon goes to the other digit. Then that's how they insert at the medial four digits. But then there is something very important about this tendon. Each of these tendon, as it approaches the metacarpopharyngeal joint, it splits into three: two lateral and the one medial. It splits into three: two lateral and the one medial. So the medial, each of the tendon splits at the level of the metacarpopharyngeal joint and into three. The one on the medial, which is one, inserts at the middle pharynx, while the one on the two on the lateral inserts at the distal pharynx here. So the same for each and every one of these tendons. So having seen the extensor digitorum, let's see the extensor digiti minimi. This is the extensor digiti minimi. From the name, you should know that it is a minimum muscle. From even the shape, it originates from the lateral epicondyle, as you can see here, and it runs downward to insert at the fifth digit. So from the name, extensor digiti minimi, it should tell you that it inserts at the fifth digit. So it joins the tendon of the extensor digitorum, one of the tendons that moves to the fifth digit, to insert at the fifth digit here. So this is it. Then we have the extensor carpi ulnaris. The extensor carpi ulnaris originates from the common origin, which is the lateral epicondyle of the humerus, and it runs medially. You can see it runs on the medial side to insert at the base of the fifth metacarpal bone. So that is it. Then we also have the anconeus. We also have the anconeus. This muscle here is the anconeus. It originates from the lateral epicondyle, which is the common origin, and some of it inserts at the olecranum process here, while some of it inserts at the upper part of the posterior ulna. So some inserts at the olecranum process, as you can see some of the fiber moving at the olecranum process here, while some inserts at the upper part of the posterior ulna. So these are the 7 muscles that we have in the superficial layer. Let's go over to the deep muscles of the back of forearm. So the muscles in the deep layer, there are 5 in number. There are 5 in number. This is the first muscle. This is the abductor pollicis longus. This is the extensor pollicis brevis. This is the extensor pollicis longus. Then here we have the extensor indicis and also the supinator, which is here. Or you can better see the supinator well this way. So we'll be looking at the origin and insertion of these muscles one after the other. The abductor pollicis longus here, it originates from the lateral part of the ulnar bone and also the medial shaft of the radius. The lateral shaft of the ulna and the medial shaft of the radius. So this is the muscle here. It originates both on the ulnar and the radial shaft. Then it runs obliquely. It runs on the lateral side obliquely. To insert at the first digit. To insert at the first digit here. Then the second deep muscle is this, extensor pollicis brevis, which originates from the ulna, the shaft of the ulna here. It originates from the shaft of the ulna and also run obliquely to insert at the first digit. You can see it also inserts at the first digit. Then we also have this muscle here, the extensor pollicis longus, which originates from the radius, the shaft of the radius, and it runs down to insert at the first digit. So these three muscle insert their tendon, insert at the first digit. Then one important thing about these three muscles is that they form the boundary of the anatomical nerve box. So this is the anatomical nerve box here, and the abductor pollicis longus and the extensor pollicis brevis forms the lateral border of the anatomical nerve box here, which contains the radial nerve as its contents, while the extensor pollicis longus forms the medial border of the anatomical nerve box. Then moving on, we have the extensor indicis here. This is the extensor indicis. When we say indicis, the index finger should come to you. So it inserts at the index finger. If you trace the tendon, it follows the tendon of the extensor digitorum that goes to the index finger to move to the index finger. It originates from the ulnar bone, the shaft of the ulna, as you can see here, and it runs down to insert at the index finger here, or the second digit. So then the final muscle in the deep group is this muscle here. If you look deeper, you see this muscle here. This is the supinator muscle. This is the supinator muscle. It originates, some part of it originates from the common origin, which is the lateral epicondyle of the humerus, while some part of it originates from the supinator crest of the ulnar bone. Then it inserts at the radial bone. It originates from the common origin here, supinator crest of the ulnar bone. Then it insert from there, it moved to the radius to insert at the radial bone. So these are the 12 muscles that we have in the back of forearm. These are the 12 muscles that we have in the back of forearm. So let me do a recap of what I've said so far. As I said that this is the brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris here, then the anconus here. Then coming to the deeper muscle, we have the abductor pollicis longus, the extensor pollicis brevis, the extensor pollicis longus, the extensor indicis, and the supinator muscle. So we've come to the end of this teaching. I'll encourage you to subscribe to my YouTube channel and also follow me on Facebook, Learn with Chisom Great. Also follow me on TikTok, Chisom_Great. Like this video, share this video to your friends, comment on this video. You are welcome.